So welcome everyone. You're here today because you were interested in learning more about Pathway to Hope. It's the program that we are launching here at ACT, developed originally in 2004. And we are working to revitalize it. And it works to address, works with and for communities to address unresolved trauma and prevention of child sexual abuse. So before we get started, I just wanted to introduce myself and my coworker. So Chimai Hui, Tara Christensen Stiller, Oswituhak, Wanguda Sophia Panangan. Hello everyone, my name is Tara Christensen Stiller. I am a Lutic Aleut and I am from Anchorage, Alaska. I work and live on Dena'ina lands here in Anchorage, but originally from Kodiak Island and from the community of Old Harbor. I have been working in the field of public health for the past 10 years. I've worked with communities to support wellness and prevention, revitalize traditional values and healing strategies. And I now work at the Alaska Children's Trust, serving as the director of the program development to prevent child abuse and neglect. And I've been here for a little over a year. And, you know, in my experience, I have never come across my experience working in the field of community health. Child abuse and neglect, sadly, has never been brought into the realm or the discussion of being seen as a public health issue when it ultimately is a significant public health issue. And it's a very challenging issue because, I mean, it affects our children, and our children are our future. So I found that very, very disturbing that, you know, child abuse and neglect was never in the realm of my community health career, in which I, you know, I've worked in nutrition, I've worked in, you know, traditional healing, behavioral health, and never came across child abuse and neglect prevention strategies or programs. So I am fully committed and passionate to working here at the Alaska Children's Trust alongside my coworker, Eliza Posner, who came into our program just a year ago. She served as the Alaska Fellow. Eliza, did you want to say anything else about yourself?
Sure. Hi, I'm Eliza. So I'm currently a program specialist at ACT after completing a fellowship. And it's just so exciting to work on projects like Pathway to Hope that really prioritize being for communities, but also being from communities, and really recognizing that communities are their own experts. And I think that Pathway to Hope brings a lot to the table in terms of cultural revitalization that a lot of programs don't. And so I'm just super passionate about this work.
Great, thank you. And I also wanted to recognize our other coworker who's online, Donna Freeman. She's our new admin. Welcome, Donna. Thank you for joining us. Grant, you know, you are the only other attendant. I would love to open up and allow you to introduce yourself if you would like to do so. Grant, did you want to introduce yourself? Oh, is he able to? Oh, he's getting into it. Okay. Just give them a second.
Hello, everybody. Can you hear me?
Yes.
Hi, I'm on the road, so thought I'd jump on, and I'm excited about the program and learning more about it. But my name is Grant Echo Hawk. I down here in the Ketchikan area in the Tlingit lands. I'm originally from, my family's originally from Nebraska, but my people are now in Oklahoma. I'm new to the, I work down here for WISH. It was originally Women in Safe Homes, but now we just go by WISH because it is gender inclusive, which is a domestic violence shelter and offers variety of services, advocacy and legal services for families and children and those impacted by violence and other, everything that goes along with it. But my project is I'm actually opening up a children's advocacy center down here in Ketchikan. I'm about a year, just over a year into the project. And at the current rate of current trajectory, I should have us ready to start accepting cases by the end of the year. So pretty excited about that. And so I'm really interested in anything, any information that can help further the mission of reducing trauma, getting support into our communities, particularly into our Indigenous communities that have been so heavily impacted over the last several generations, so we can do to help reduce that trauma so we can heal and create strong generations moving forward. So yeah, I'm excited by this program.
Thank you. We're so happy to have you, and congratulations on getting that CAC. That's so great. So Kriana, thank you and welcome. So here at ACT, like I said, we're here to prevent child abuse and neglect. And Pathway to Hope is looking at addressing healing unresolved trauma and preventing child sexual abuse. But why should we focus on child sexual abuse? Well, as you may well know, the statistics are very not good at all, and they haven't been for a long time. And we need more programs, not programs, we need more movements. When I think of programs, I think of something that comes in and tries to put something there and then leaves when the grant funding is gone. We want to move beyond that. We want to create a movement for children and communities to recenter children in the center of our communities and see them for what they really are, our future, our generations. We need to work with them and for them and plan for those next 7 generations. Alaska, according to STAR, has 6 times the national average rate of child sexual abuse. 36% of Alaska women reported having experienced child sexual abuse, and 8% have confirmed victims of child abuse and neglect experienced CSA. Of them, 4% have experienced CSA. Child sexual abuse is challenging because it's not clearly tied to risk factors like many other preventable health disparities affecting not only our people but nationwide. It's not like decreasing saturated fats and increasing exercise to prevent heart disease. Therefore, it takes a whole community to prevent and heal from it. It'll take unique and innovative, culturally appropriate strategies to address our CSA issues in Alaska. It's something that's connected to unresolved trauma, historical trauma, and it's a cycle that leads into current and risks bleeding further into future generations. So I see this as the risk of something we cannot risk not doing, is creating that awareness of where we're at, not to just doom and gloom on our communities or our state, but really see it as a starting point of this is where we were and look at where do we hope to be. Instead of, like I said, instead of only focusing on stopping the bleed, Pathway to Hope works to prevent the incident from which the injury led the bleed to happen in the first place. In other words, primary prevention. We could move on to the next slide. I don't know if I control that. So working at ACT, I was tasked with, like I said, learning. It was a whole new learning curve regarding the topic of child abuse and neglect. So I did a lot of research and thinking about what can we do to address CSA in Alaska. And I was blessed to find Pathway to Hope, or maybe Pathway to Hope found me. It's the only Alaska Native Indigenous model framework that incorporates culture, community history, traditional values of the specific community in which it's implemented. It's based on the belief that healing requires support and information that sustains effort, that contributing to healing Native survivors of CSA takes place when Native people work within their own communities. Community ownership and empowerment to address harm and healing must be community specific to succeed. So this model, like I said, was developed in 2004. The founder was Diane Payne. Unfortunately, due to her passing a few years back, the program didn't have the capacity or funding to move forward. It had been delivered across 5 states and 2 countries and was invited before she had passed to international places. I believe down in New Zealand, they wanted her to go down and share this wonderful framework that was built not only by Diane, but by Alaska Native stakeholders who were working in the prevention field, who were elders, who were parents, who were everybody who wanted to see change around child sexual abuse. And the program really stresses, we want to break the silence of child sexual abuse. We want to remember how our ancestors solved issues and forget Western ways of keeping silent as children were in the past at residential schools. We can't heal until we break that silence. And that's what Pathway Hope does. It reminds us of the tools that we used that helped us to heal. And we'll talk a little bit more about those in a minute. So this program provides training to community members in order to facilitate the open dialogue in which participants use their cultural strengths and values to create their own collective circle of safety for their healing journey, which looks different in every community. It looks different in every individual, in every state, and so on. So through applying unique Indigenous learning style and experimental approaches, the program guides these facilitators to instruct community participants on issues relating to CSA dynamics and survival, healing and wellness for their community, and working with their community to develop strategies. So increasing that knowledge and awareness, and building capacity within the community by learning the current statistics and that baseline data we were talking about, our starting point, so that we could say and see where our starting point is. And then we could look to where we want to be for our future in healing and prevention of CSA. Next slide. Again, like I said, we're hoping to build capacity in communities. We're not going into communities and being facilitators. We invite communities here to train to become facilitators, to lead their community in prevention efforts, however that may look. We provide these facilitators with tools to assess needs in their communities. Again, learning how to identify that baseline data unique to their community, only for their community. All that data that will be collected is just for them, so that they can see where they're at and they can plan for their future, where they want to be. Next. So this year is a pilot year. We have obtained funding for 5 years to implement Pathway to Hope. And in those 5 years, this first year is going to be a pilot in which we will invite 4 participants selected from 2 communities. So why so little? We really are intentional with our work. We want to build that relationship with the community, and do the work we need to do before we leave the community facilitator into their community, trying to talk about these hard things that are that have been blanketed and silenced for decades and bled into those generations. So again, we are starting small, intentionally, so that we can really focus and build a better movement in addressing CSA in our communities. So we will work now to recruit, and then we will provide pre-work training, which we will work with those potential facilitators, and do the pre-work is mostly just learning about CSA, what it is and what it looks like nowadays. Gaining that understanding of basic CSA data, and begin learning about the framework to address it. And then we'll invite them in for an in-person training, in which we'll go more in depth in working to train them on those tools, some traditional, some modern day public health tools that communities can use to establish that baseline data, and then also integrating their own traditional ways and values to really make communities feel that this is theirs, it's not ours. We're just here to guide and help. And then our ultimate hope is that they'll go home and they'll begin those assessments and develop and implement action plans over the next 5 years. So this pilot year timeline, of course, since it's a pilot, it is very not set in stone. I want to say we want to be flexible again with this work and ensure that communities know and understand that the work that we're trying to do is intentional, and the work around CSA prevention is very sensitive, and we want to work with communities to gain that invitation and support them in any way we can, provide them tools and build that capacity, however it may look like for them. So that's our basic timeline, but not set in stone. So on with the application, I'm gonna hand it over to Eliza, and she will start discussing the application. And yeah, I'll let her go ahead. Thank you, Eliza.
Thanks. So we have reformatted our application slightly in response to feedback that we got from our Alaska Native Advisory Group. So if you've taken a look at our SurveyMonkey application, we ask for a lot of community-wide information and then community facilitator specific information. And so I'm going to show you the new version of the application in a minute. But what we've decided to do is to really focus on recruiting those community facilitators. So if you'd like to be a community facilitator for your community for Pathway to Hope, you'll submit that application. We're looking for 2 per community. And then we're also going to ask you to start thinking a bit about that more community-wide information regarding CSA that will really help your community begin to formulate an understanding of where the community is currently at and develop those strategies and implement those strategies. And then there will be a meeting with ACT staff where you can discuss that application and also get more into that information regarding CSA in the community that we understand is super sensitive and not easy to discuss. And so we want to make sure that communities feel safe and supported throughout this process. And also that communities want to bring this program to their communities and really want to make Pathway to Hope their own, because that's our primary goal. So I'll stop sharing this screen and I'll share the application.
And we just want to stress the information that's on the application is not for us. It's for you and your community to start beginning to create that baseline of where you're at, what are perceptions around CSA in your community, and what are your basic resources that you have available right now. And we also want to stress that if there's any information you can't fill out right now, that's okay, because we're going to meet with you one-on-one with the application, and your other fellow community facilitator applicant to really discuss and go through and ensure that you know that any information that you provide is your information and it's safe. Thanks.
Thank you, Tara. So this is the application. It'll be formatted as a PDF that you can fill out and email to Tara and I. So it gives you a little bit of a project overview and the project goals that Tara just went over. And then a little bit about who can apply. So like I said, this is specific to community facilitators. So we're hoping for 2 community facilitators from 2 communities. So 4 community facilitators total. So each prospective community facilitator will fill this out. And there's some basic information here about the role of a community facilitator, which, like Tara mentioned, begins with that pre-work and pre-work check-ins, and then attending the in-person training, and then really going back to the community and working with the community to gather that information, do that community readiness assessment, and develop and implement those action strategies. So the application asks for some basic information about you, And then it really gets into, why you're interested in this work, why this topic matters to you. And this is really, we want this to be open-ended. So any information that you want to tell us, feel free to put on your application. And it's totally confidential. Will not be shared with anyone else.
And also, I just want to stress, this is a very informal, we're not going to be grading you on anything like grammar or editing. We just, want to have some information so that we could start the conversation and work with you to build this for you and your community.
Definitely. Yeah. So then it asks a bit about how you see where your community's at regarding CSA. And again, if there's questions here that you don't feel like you know the answer to, or that you want to discuss more with us in person rather than in writing, that's all fine. This is a really informal process. And it's like Tara said, we're asking these questions because they're meant to help you as a prospective community facilitator to begin gathering that information that's going to help your community. It's for the community, not for us in any way. So it's meant to help you on your community's own process to breaking the silence and preventing CSA. And then it just asks some basic information, like we'll ask for references and then some demographic information. And then at the bottom, if you decide that you'd like to participate in Pathway to Hope and you fill out this application, we'll then have that meeting where we'll ask you and your community to start thinking a little bit more about CSA in the community and asking some of these questions that we've listed here to really help you think about where you're at in terms of readiness and start that community readiness assessment process. And this again is the part of the application where we'll meet with you to really discuss this and answer any questions you might have.
And we'll also be providing you with hands-on one-on-one training to develop the skills to conduct this assessment. We have a great evaluation team who I've worked with for the past 5 years with a couple of our communities to conduct these community readiness assessments. Really, it's just, again, to identify that baseline so that you can see where you're at, so that you can develop more targeted strategies to see better results.
Yeah, and our evaluation team is really focused on helping to build that capacity for our community facilitators so that they can really evaluate their community's readiness themselves. So again, it's about gathering this information for the community to really help the community.
Do we have any questions? And I just also wanted to mention the request for references. We don't have to do that right away either. We could wait and have the discussion.
So in terms of next steps, we'll be sending out a letter on Pathway to Hope. Oh, sorry, one second.
So as Eliza was saying, we have developed a letter to communities that will invite and inform about the Pathway to Hope program. And we'll be sending that along with the PDF file for the application. And you're more than welcome to ask any questions now and later if you have any.
And we'll also include a recording of this webinar with that letter and the application. So if you know folks who you think might be interested, but we're not here, feel free to forward it to them.
I see your chat, Grant, and you know, if you have any supportive workers who you have in mind that would be willing to come and train, even though you can't, that would be great as well. We would love to, even if you weren't able to be a facilitator. Melanie, did you have any questions?
No, thank you. I was late coming on, but I think I got the gist of it. Yeah, I think we're interested, but I've forwarded the information to our grant writer as well, just so that we can have a discussion before I apply.
Great. Hopefully see someone else. Hi, welcome. Is it Charis?
Therese?
Therese, sorry. Welcome. We unfortunately just finished it, but we did record this session. And if you have any questions right now about the program or about the application, you're more than welcome to do that right now, because that's what we're sharing. And yeah, if you have any questions about it, and we can provide you the recording from today.
Oh, I'm so sorry. I missed it. But yeah, if I can get that recording to view, that would be great. But I don't have any other questions at this time. Thank you though.
Yeah. And like Eliza said, we'll be sending out a letter and attach the application, and we'll have it in a PDF form, so you could enter the information, or you can print off the application and write it and scan and email it to Eliza or myself. And we'll have those instructions on there as well. If there's no further questions, we just want to thank you all for joining us today, and please don't hesitate to contact myself or Eliza. We'll put our information in the chat. So yes, please contact us, and we look forward to hopefully getting an application from all of you. So I just want to say thank you, Kuyana, and have a good day.